Good morning, respected sister, and all my dear batchmates. I, Clara Frederick from BSc Nursing second year, am here to present my topic on antiviral and antifungal. So, first we will see what is antiviral. An agent that kills a virus or that suppresses its ability to replicate and hence inhibits its capability to multiply and reproduce. As antiviral drugs are class of medication used for treating viral infections, most antiviral drugs are targeted to specific viruses, while a broad spectrum antiviral is effective agent a wide range of viruses. Unlike most antibiotics, antiviral drugs do not destroy their target pathogen, but antiviral drug acts by inhibiting the multiplication of the virus. It was used to lessen the severity of disease. Here, lessen means diminish or become less, particularly in individuals at high risk, such as those who are immunosuppressed. So, viruses are not normally affected by antibiotics, but a small number of viruses can either be destroyed or have their growth stopped by drugs. Under antiviral, first drug is amantadine. Amantadine is used to prevent or treat infections of the influenza virus type A. It is recommended for patients who cannot or should not receive influenza virus vaccine. So amantadine is prevent or treat infections of influenza virus type A. It is for those patients who cannot or not receive influenza virus vaccine. These vaccine. So next, dose. For children 1 year old, no data available. 1 to 9 years old, 5 mg per day, maximum 150 mg daily in 2 divided doses. 10 to 17 years old, 1.4 mg, maximum 100 mg twice daily. For adults 18 to 64 years old, 1.4 mg, maximum 100 mg twice daily. Disease stable based dosing. For children 5 mg per day, maximum 150 mg day in 2 divided doses. For adults 80 ml 1.4 mg kg every 12 hours. Next is mechanism of action. Amantadine interferes with the release of infection's viral nucleic acid into the host cell through interaction with the transmembrane domain of the M2 protein of the virus. It also appears to prevent virus assembly during replication in some cases. Side effect of amantadine: dry mouth, constipation, nausea, vomiting, decreased appetite, difficulty falling asleep or staying asleep, and headache. These are the side effects of amantadine. Next is indication. Amantadine was used in earlier 2000 for influenza A treatment. A 2006 meta-analysis showed that the drug decreased influenza symptoms by 1 day and decreased the severity of fever and other symptoms. However, high levels of resistance have emerged recently, initially from Asia and now to North America. As of 2011, the CDC does not recommend treatment or prophylaxis of influenza A due to high levels of resistance. Amantadine is now used mostly for Parkinson's disease. Contraindication: amantadine should be used with caution in patients with a history of seizures or heart failure. Nurse's responsibility: assess Parkinsonian and extra paramedical symptoms. Caution patient to make position changes slowly. Instruct patient about frequent rising of mouth. Inform patient that this medication decrease perspiration and overheating may occur during hot weather. Next topic is antifungal. Antifungal medication, also known as antimycotic medication, is a pharmaceutical fungicide or fungi aesthetic used to treat and prevent mycosis such as athlete foot, ringworm, candidiasis, Serious symptomatic infections such as cryptococcal meningitis and others. Under antifungal, the drug is terbinafine. Terbinafine is an antifungal medicine. It is used to treat skin infection caused by a fungus, yeast, including athlete foot, fungal, nail infections, etc. Next is dose and route. For adult and pediatric doses, forms and strength. Tablets 250 mg, packet oral granules 125 mg, 187.5 mg. Doses consideration should be given as follows: 250 mg 1 tablet orally daily for 6 weeks, fingernail or 12 weeks toenail. Tinea pedis off label 250 mg day oral in single dose or divided every 12 hours for 2-6 weeks. Mechanism of action. Terbinafine has a fungicidal effect by inhibiting the enzyme squalene monooxygenase, which is involved in the synthesis of steroid in fungi. This inhibits fungal steroid biosynthesis by decreasing ergosterol levels. Fungal membranes are not able to grow because ergosterol is one of the main components of the fungal cell membrane. Side effects: rashes, headache, diarrhea, feeling of becoming nausea or vomiting, a smaller appetite than usual, stomach ache, indigestion, muscle or joint pain. Indications: Clemacin tablets are indicated for the treatment of onychomycosis of the toenail or fingernail due to dermophytes. Contraindication: Terbinafine tablets are contraindicated in patients with chronic or active liver disease, history of allergic reaction to oral terbinafine because of the risk of anaphylaxis. Last is nursing responsibility. Assess and drug effects. Monitor for and report increased skin irritation. Patient and family education. Learn correct techniques for application of cream. Notify physician if drug causes increased skin irritation or sensitivity. Be aware that medication must be used for full treatment time to be effective. Do not breastfeed while taking this drug. Thank you.